So we've talked about the benefits and the risks, all the different types, and if you decide that HRT is right for you and you've decided on the particular type that might suit you, then yes, I do have to say there will likely be some side effects, and I really like to tell my patients up front about the side effects just so that they can anticipate them, and also to let them know that it's really likely that they will last a short amount of time, sometimes as little as 2 weeks. Often they're gone within the first month. Sometimes they can linger a little bit longer, but they generally settle within 3 months, and if not, then we really want to be thinking about how we can make that more comfortable if women are getting benefits from their HRT. These are some of the most common side effects associated with the different elements of your HRT, and probably the top 4 are things like breast tenderness, bloating, feeling a bit low in mood or mood changes, and irregular bleeding. So if you're not on a long-acting Mirena coil intrauterine option for your progestogen, or had a hysterectomy and you're still getting some bleeds, then you may find that you get a degree of erratic bleeding. Sometimes it can happen on the Mirena coil. I've not seen it quite as much, but it's really quite common in the first 3 months. It's nothing to be overly worried about, and if you are concerned, you absolutely can come and speak with us, but it's really common and should settle in the first 3 to 6 months after starting HRT, or unfortunately every time you change your HRT dose, then sometimes that can cause irregular bleeding again. If that continues for more than 6 months after you started, or for more than 3 months after you've changed the dose of HRT, then we would want to investigate that further to make sure that there's nothing else going on. So what will happen when you come in and to talk to us about HRT? Then we will ask you some general questions. We're interested in your age, your menstrual history, and the symptoms that you've got. So I would really encourage you to track your symptoms and also the severity of those symptoms in the preceding months prior to that appointment. But if you haven't, that's absolutely fine. It's not mandatory, and we absolutely want for you to feel that you can come in and talk to us about those. You might know the symptoms, you might not know what symptoms you're trying to track, and there's plenty of help out on the internet, but also we talked a lot about symptoms in our other talks, so please go back and have a listen to that. We're interested to know, we're trying to understand, are you postmenopausal, are you perimenopausal, where are you on this hormone journey? And a couple of things that we really want to document is your height and your weight, so we can look at your BMI. It's certainly not a judgment, it's really about making sure that we choose HRT that is safest for you and has the most benefits and the least risk, and also checking your blood pressure as well, because unfortunately with the age, often hypertension starts to creep in, and we want to make sure that we're keeping you healthy and your cardiovascular health in tip-top condition. So you'll come to the consultation, and we're going to talk about, we're going to ask you quite a few questions probably, and this is just really important. So please try and be as open as possible with us, and also there might be a lot of things that you want to talk about, and things that potentially you can't remember, and that's absolutely fine. But if you can be as thorough as possible, that's really helpful. And we want to know about any abnormal bleeding. We're interested in you and your medical and your surgical history. Have you had any gynecological procedures? Have you had anything that's affecting your liver, your heart, your clotting, cancers in your family or in yourself? We will have a medication history, but if there's anything else that you're taking that you've bought recently, supplements, herbal remedies, and things that you bought over the counter, then please let us know about those. It's really important to talk about allergies as well, because there are sometimes times when certain medications might be an issue if you have a certain particular type of allergy. Even if it's not obvious, sometimes there's what we call cross reactivity with other ingredients in medication, and so we'd want to know about any allergies or newly developed allergies that you've got. Contraception is important because HRT is not contraception. It's really important to be clear about that. Until you get to the age of 55, then depending on how long you've not had a bleed for, or whether you're pre, peri, or postmenopausal, then you will need different contraception options. So unless you're planning a pregnancy or want to become pregnant, then we want to make sure that you're getting the cover that you need. And we're also interested in your lifestyle as well, so that we can have a really holistic approach to talking about getting the best results for, if you're on HRT, but also just generally for symptom control as well. So there are different prescribing options, whether you're perimenopause or postmenopause. In perimenopause, we will give, if you have a uterus still, then you will be on combined HRT. So if you are looking for a patch, then you can have the estrogen and the progestogen in a combined patch, and that's Everel Sequi. In those, you get 2 weeks of just estrogen only patches, and you get 2 weeks with the combined patches, which makes it really easy to remember to take both of those elements, the estrogen and the progestogen. And what's happening during perimenopause is if they're getting bleeding at all, then we want to try and mimic that cycle. So and as erratic as it might be, then what will happen is that the HRT will then become the dominant hormone cycle, and you should start to see a more regular pattern in your bleeding. It may feel nice to think, oh, well, I'd just rather have constant hormones, progestogen and estrogen, so I'm not having bleeds, but we know that if we start that too early, if you're in the perimenopausal and not postmenopausal yet, then you get a lot of erratic and unpredictable bleeding patterns, and so you may well end up being worse off and having multiple bleeds a month. So if you're still in perimenopause, we would start you off on a sequential or cyclical HRT regime. Now, you might have a Mirena coil. So if you've got a Mirena coil, then you will naturally be on a continuous regime of hormones. So you'll have an estrogen patch or an estrogen gel, and the Mirena will be your progestogen element. Or you could pick Utrogestrone, which is the body identical progesterone, with either the patch or the gel. Or, like I said, you can also get oral HRT options as well. You can get oral estrogen only tablets, estrogen and progesterone combined tablets, and so this is just to give you a flavour of the different sort of combinations that you might see being discussed. If you're postmenopausal, then we would have what's called a continuous regime. It would be a continuous combined regime if you needed progestogen as well as estrogen. So if you've got a uterus, if you're not needing the progesterone element, then it would just be an estrogen only continuous HRT regime. If you are looking for a combined progestogen estrogen, then it comes as a one type in a Everel Conti patch, so it's all in one patch for you. If you'd rather separate out the patch, you can then have the patch with the Utrogestrone, which has the added side effect of making you quite sleepy, which for some women might be a huge benefit during their menopausal years if they're really having a lot of sleep issues. That can be used to our advantage. Or again, you can have a Mirena coil fitted as well to provide your progesterone element. And like I said before, we've got oral HRT options as well. It's important to say that these doses that I've put on there are standard doses. They come as low dose HRT as well, and you can also get moderate dose and you can get high dose. High dose estrogen therapy, which is 100 microgram patch, 4 pumps of gel. These will require higher doses of the progestogen to balance that higher dose of estrogen in order to ensure that you have enough endometrial protection. So in those cases, you would have higher doses of the progestogen, and so that's important, and your prescriber will know that. that's a lot of information. I hope you found this a very useful talk, and it's something that you can go back to and reference, and also feel free to come and discuss any or all of these options with us at the practice. I will leave you with some resources because there's a lot of information out there. I would suggest these are really good evidence-based resources. That the Women's Health Concern is run by the British Menopause Society, so that's got lots of fact sheets and infographics on there. Menopause Matters and the Balanced Menopause Library have a lot of really good information, and there's an app for tracking symptoms as well, and scoring and tracking symptoms. And the International Menopause Society has lots of information in a variety of language. So if English is not your first language, then you might find that if you go to the International Menopause Society, you can get videos, podcasts, booklets, info sheets in multiple different languages. So that is a really good resource to access as well. This is our contact information here at the practice. You know where to find us. That's our reception number. And we have a website with all of that information, useful information on as well. And we have a Facebook page as well, which we like to put information on to update you and to provide further menopause support as well. There's a variety of different ways that you can access menopause support in the surgery. We offer short face-to-face consultations on one-on-one. We're offering group consultations as well, and we will be providing more videos like these, info sheets, signposting you to other resources that we think you might find helpful. So thank you for taking the time to access this video.